Hi, welcome to Pinnacle Hand Therapy. Today we're going to go inside and we're going to talk about physical agent modalities, also known as PAMs. Okay, we have the hydroculator right here, which houses our hot packs. And this is an interesting machine in the sense that the water that's on the inside is 160 to 170 degrees Fahrenheit. That is very, very hot. But by the time you take that hot pack, which is filled with like a sort of a mud material, and you lace it into the hot pack cover and you use towels, it actually will reduce the heat to roughly around 104 to 111 degrees for your patient to get heat. One fun fact about our hydroculator, we will use the water to actually make a splint if our splint pan is not hot enough. The other thing that we do, because our patients don't like the ultrasound gel to be cool, we actually warm our ultrasound gel on our hydroculator. So what I'm going to do is I'm going to show you two different types of hot packs. The cervical hot pack, which gets its name because typically it is used around the cervical region, but we use it in the hand therapy clinic around fingers and the hands, and then of course your standard pack. So the first thing I want to do is I am going to position my pack. I'm going to use my tongs because you definitely don't want to touch 160-degree water with your fingers. So I use tongs to take it out. I like to let some of the water shake out of it, and then I lay it here, and then once I get it out, I feel pretty good to move it around with my fingers, but there's actually sort of a pocket on the inside that allows me to sort of fit this into. And you want to make sure that it's nice and flush, because when you get it to your patient, you don't want it to be bulky. But this right here, the cover, gives you about 2 layers, and then we take a towel, fold it in half. So you're getting anywhere between 4 to 6 layers of padding before you place this on your patient. So that is your cervical hot pack. And then, of course, the other one that I promise will fit nicely into this terry cloth mitt, and that is called a standard hot pack. So if I can reach in here and locate one. So this is our standard. Again, letting it drip just a little bit. Put my tongs away, close the box for safety. And this has Velcro around the edges, so I can just seal it nicely. And just like with the cervical pack, I'm going to fold it in half, and then I'm going to make it available to my patient. And keep in mind, before you administer any of these modalities, you would have checked to see what your patient's sensibility is, therefore knowing that your patient can tell you whether or not something is too warm or too hot. We advocate for the patients to tell us if it's uncomfortable. It's so important for me to say that it's not that something is too hot, because we have biomedical engineering checking the temperature. Typically what is going on is how the patient actually receives the heat. So say, for example, if I put this on a patient and they tell me it's too warm, then what I'm going to do is I'm going to give them more padding. And as they say in Hollywood, that's a wrap.